Health Network webinar series. I am Marie Brousseau-Navarro. I am the Deputy Commissioner and Director for Health at the Office of the Future Generations Commissioner for Wales. And I'm very excited to do this webinar today about this wonderful tool which we created in collaboration with Public Health Wales. And the tool is called Beyond the Present: How to Apply Long-Term Thinking to Reduce Health Inequalities in the Future. As you know, we are facing challenging times in Wales and across the world with our healthcare services, wider sector, and the third sector under unprecedented strain. This makes it even more important than ever, but also harder than ever, if we are honest, to balance this managing the crisis and facing all of us and preventing future ones. But the Well-being of Future Generations Act demands that we do it. And this is why our office is providing support here in collaboration with Public Health Wales. And there are tools and resources that can help with this. And we want you to learn about them. And that's why we created this webinar today. So today we are joined by amazing speakers, which include Petranka Malcheva, who is a colleague of mine and who will start the presentation. Pep is Future Generations Comrie lead for the work on long-term thinking and foresight and health prevention. She's currently seconded to Public Health Wales on a part-time basis, and her role includes supporting the implementation of the 5 ways of working through developing trainings, tools and research, which include this Beyond the Present resource. Outside of the office, she likes reading fantasy and sci-fi books to take pictures of her dog and slowly kill our household plants. And she also loves to compare the Welsh and Bulgarian weather. The second speaker will be Sophia Bird, Principal Public Health Practitioner on Obesity Prevention and Nutrition at Public Health Wales. Sophia has worked in health promotion and public health since 1996, and she's joined the Powys Health Promotion Unit as their Research and Evaluation Officer. Whilst in Powys, Sophia worked in a variety of topics over the year, and she's increased her public health experience, leadership, and management skills, becoming a principal practitioner in 2005. Sophia joined the Health Improvement Division in March 2019 as part of a Healthy Weight teams, contributing to the planning, implementation, and evaluation of a number of strands of the Welsh Government Healthy Weight strategy. And finally, Tom Moses is a project coordinator, a Haverfordwest Town Councillor with 25 years experience of youth, community and inclusion work. And Tom sees young people as a future of both our communities and our democracy. But yet, as the level of democratic engagement and participation are in decline, and the opportunities for engagement and improving their life chances are often missed. So, Planned Cumbre Youth Project, and I'm sure you can pronounce it much better than I have, is supported by the Lottery Community Fund and Welsh Government Democratic Engagement Fund, has worked to support town and community council in Pembrokeshire to better involve young people in their work, with particular focus on older young people aged 16 to 25 years. So after the presentations, there will be a chance for you to ask questions, and please use the chat throughout the presentations, and you are welcome to use contributions in either Welsh or English. The webinar is recorded and it will be made available on Public Health Network's Comrie website after the session. And if you experience any difficulties with technology, please let the team know in the chat bar. So now we will listen to the presentations of our speaker, who will have approximately 10 to 15 minutes, which will then leave time for us for a Q&A session at the end. So thank you very much for joining us. And I pass over literally to my colleague Petranka Malcheva, who is next to me as the first speaker. Thank you very much.
Thank you very much, Marie, for introducing us. Let me just put my headphones in and hope you can hear me. And I will share my slides now. And if someone can give me a sign, Marie or Catherine or Jamie, that my slides are indeed visible, I can then start.
Yes,
Hopefully every great. Thank you very much. So as Marie has said, I am Pep. I'm from both Public Health Wales and the Office of the Future Generations Commissioner, and I'm one of the authors of the tool that we'll be showing you today, which is called Beyond the Present. And I will start my presentation and my speaking from a little bit further upstream with the Wellbeing of Future Generations Act. So I'm not going to bore you with the details of the legislation, as most of you would know it quite well by now. But it is one of the most ambitious culture change projects that we're very lucky to have here in Wales, and it contains a number of elements in the legislation that I will not go into detail, but the most important ones are that it sets a long-term vision for us here in Wales in the shape and form of the 7 wellbeing goals, and it also provides us with the how do we get to that vision in the form of the Sustainable Development Principle and the 5 ways of working, which are collaboration, integration, involvement, long-term, and prevention. And today we're going to hone in a little bit on the long-term way of working and on the idea, basically, that is at the heart of the legislation of leaving the world better than we found it and acting today for a better tomorrow. So what the long-term way of working is, which, as I said, I think is at the heart of the Wellbeing of Future Generations Act, I have pulled out a little definition here for you, but basically at its core, it means balancing the needs of today versus the impacts of tomorrow. It's not about, completely forgetting about current generations. It's about caring and considering the needs of both current and future generations at the same time, and that time being right now. And all of us in the public sector in Wales have to do it, as this is a framework around everything we do. But it can be, it's quite important to think long term, because it can help us avoid sleepwalking into the future. It's quite an obvious one. It can help us avoid decisions that we have to go and undo tomorrow because they're just not fit for future generations and are no longer fit for the needs of people in the future. It can help us deal with uncertain, complex situation, and we're increasingly living in a very uncertain and complex world. And using long-term thinking can help us navigate that. It can help us navigate situations where we don't have any past experience, or our past experience is just no longer a good guide because things have changed so much and moved on so much from what we know in the past. And finally, and very importantly to me, I think that's the most important point, it can give us agency and help us build a future that we want to be a part of. It can give us agency to build joint futures together with people and involve everyone, and kind of create this collaborative visions of what we want to see for ourselves and for our children, nephews, nieces, grandchildren, and so on in the future. But very importantly, from kind of a legislative point of view in the Wellbeing of Future Generations Act, starting with the long-term way of working can naturally lead us to all of the other ones. So starting to think about the future can help us bring very different perspectives into the conversation and integrate different viewpoints. It can bring people together around a shared vision and a shared challenge. It can help us involve people in a creative and engaging way, rather than through just traditional methods that we tend to use in our systems. And finally, it can help us hone in and focus on the root causes of issues and the prevention of these issues, rather than just addressing the symptoms. So it's a good way to start, but it naturally leads to everything else that we want to see people doing in Wales. Of course, there are barriers, and none the least, and that's one we hear very often, is the budgetary barrier and the fact that we're all experiencing some very short-term financing. So how can you do a long-term thinking on a short-term budget? And that's very valid, very important, and it would massively help everyone if we did have longer-term budgeting and if we did have that financial security to be able to start projects that went beyond the year or beyond 3 years. But it's only one tool. Funding is only one of the tools that we have to move this boulder that you see on the left-hand side of our short-term thinking system. And we have other tools that we can utilize at our disposal, such as systems and processes and policy and regulation. Arguably, we do have the policy and regulation here in Wales in the form of the Wellbeing of Future Generations Act, knowledge exchange sessions like this one that we're doing right now, collaborations and the pooling of budgets together to create something bigger, systems working, which is very similar to, as a concept to the Wellbeing of Future Generations Act. And finally, the most important and biggest lever is mindset, belief, and culture change, which can be difficult and it does take time. And I've pulled a slide here that I've stolen from an RSA report, which I recommend. It's called A Stitch in Time. But these are six ways of thinking long term and six mindset that we need to develop to shift from that short-term focus that we tend to have in our work lives and onto that more longer-term thinking. So the first one is around recognizing that deep time humility, recognizing that we're only a tiny speck in space-time, and there is a whole universe around us that we are just a part of. Having a legacy mindset, that idea of leaving the world better for those that come after us. Holistic forecasting is around ensuring that you're not siloing your thinking and you're creating multiple visions and taking into account multiple considerations. Cathedral thinking, which is one of my favorite ones, is this idea that all of these challenges that we're trying to address and all of the solutions really lie beyond just our career and maybe even beyond our lifetime. And we are just a part of what needs to happen. So how do we lay the blocks today that will create the foundation for the future? That intergenerational justice, then about being a good ancestor. And finally, that transcendent goal of we're all part of one planet and we're all striving together towards the same thing. So we need to really shift, as I said, our minds from our short-term urgent considerations into a more balanced view of there are impacts and everything we do today impacts on the future, and we need to be aware and consider that and prepare for that, even if we can't predict it, as we're not, I think I heard Derek say today, Mystic Meg. This is not someone I know, but I think people will know who I mean on the call. And it's especially important to do this in our health systems and in tackling health inequalities. As Marie has already said, we're under unprecedented strain as public services, as voluntary sector, as health and social care sector. We're facing so many big challenges and people's lives are being cut short because not everyone gets the same access to these building blocks of healthy and good lives that we want them to have and that they need to have to prolong their healthy life expectancy. So because of all of these challenges and this strain on our public services, it is more difficult than ever, as Marie said, but also much more important than ever and much more urgent than ever that we start thinking long term and we start thinking about these challenges in our health system and how they're going to impact our future generations. So that we can start creating this, house that I have on one side with these building blocks and ensure that all people, regardless of their background, do have access to these building blocks of health in the future, both our current but also our future generations. And that is why we have created this toolkit, because it can be very, very difficult to know when you get into long-term thinking. It can be very difficult to know where to start because there's thousands of tools and methodologies out there. It can be very lonely because you think, oh, no one else is doing it. And it can be very intimidating because there's a lot of very expensive experts and consultants out there that are very useful and have their uses in big projects, but it doesn't necessarily mean that you can't do it and you can't try stuff out on your own. So to address all of that, we wanted to create a really simple and straightforward resource that combined the solutions to some of these, hopefully all of these issues in one place, and that helped, stood as kind of a guiding light really for people that wanted to start trying out new things in terms of long-term thinking, and especially in relation to health inequalities. So Beyond the Present is a tool that takes a variety of different methodologies and different futures techniques and sets them out on a reference page really, and alongside different questions that you need to ask as part of your decision-making process. And it tells you which methods are best for which part of the decision-making process. It tells you you start here, you then can move on to here. It gives you a lot of detail about each of these methods. It tells you how long it takes, whether you can do it on your own, who do you need in the room, all of that information that you need to initially decide, is this the thing I need or is it something else? And then it points you to more detailed guides then that can literally tell you how to set up a whole workshop or a whole session on your own. It also, I think, quite helpfully gives you ideas and tips in terms of where should we start, where can I just go and dip my toes a little bit in long-term thinking, low stakes situations really, such as in internal policies and team days, involving people and stakeholders in your projects and so on, just so you can get a bit of that confidence. We have collated also a lot of tips from all of the case studies that it contains and siphoned them and collected them in one page, which turned into some principles that you basically should keep in mind, such as, you shouldn't do it in isolation, don't be afraid to be creative, and it doesn't have to be perfect, which sound very, very generic, but there is more thought behind them when you get into the gist of it. As I said, it contains all of these that you can see here on a page, all of these methodologies. It gives you, the timing needed, the resource, and it's interactive. You can go directly to the case study, and it also tells you how you can use the other 4 ways of working within this method, which is very helpful when you want to be evidencing that you're doing all of them at the same time, and when you need to think about, oh, how do I bring this into the equation as well? And finally, the most important bit of it is that it contains a host of case studies, I think about 15, 16 case studies of innovators across the public sector in Wales and across other sectors as well, that are going out and doing all of these things and trying out these methods. And it details how they do it and what impact it is having, their tips for replicating it, but also the ways in which they've adapted the method to suit their needs rather than just be married to, oh, I need to do it in this specific way. So it contains a lot of creative methods, a lot of innovation, and we hope that this tool is both seen as practical because it's in a very simple language and accessible language. It is quite straightforward. It tries to present everything in a very practicable way, but it's also very inspirational because it shows the bold change makers that we have across Wales that are not afraid, and I hope it inspires you as well, in terms of going out and trying some of these things. And because I forgot to do it when I was meant to do it, can we put the first poll up now, Jamie, with the question? I wanted to ask you guys if you have ever tried out any futures methods yourself in your work. I hope Jamie is putting the poll. I can't see because I'm sharing my screen. Do I need to stop sharing my screen for it? I hope not.
It's happening already, Pep.
It's happening. Okay, I can't see it, but
happening
hopefully
before
people.
my eyes.
Amazing. It's very, it's very weird when you can't see what is going on in the chat and in the polls as well. But hopefully we're getting some responses from people. But yes, and finally on the last page as well of the tool, it contains contact details for all of the different organizations doing something about futures in Wales, because as I said, it can feel quite lonely, and if you just want to chat to someone and ask, oh, how did you do that? It contains that information for you. But I'll stop talking now because we have two much more exciting speakers than me today, which actually went and did the work, and we have their case studies in the tool. So I will pass on to Sophia Bird, who is a colleague from Public Health Wales. Sophia? Just tell me when to switch slides.
Okay, so I'm Sophia Bird and I work in Public Health Wales. If you want to go on to the next slide, then please, Pep. So I've got my person helping me out here. So Pep's going to move the slides on for me, but it's not moving on yet for me. There we go. Thank you. So I work within the obesity prevention team within the Health Improvement Division, and the numbers here on this slide show the challenge. For many of us, we're very aware from COVID-19 pandemic how living with overweight can put people at a much higher risk of death and complications than somebody who is a healthier weight. Overweight and obesity, we now know that they're risk factors for several chronic conditions, from cancer to stroke to diabetes. And poor diet and sedentary lifestyle are the main causes of overweight and obesity, but they're not always within the individual's control. And in fact, our weight is often actually strongly shaped by where we live and things such as what we might be able to afford to eat. For example, people who live in the worst off areas of Wales are much more likely to experience overweight and obesity, and often their environment is conducive to that. So it's really important for tackling overweight and obesity that we tackle inequalities so that people have equal access to living a healthier life and well-being. So for me, by working through the healthy weight agenda, we are tackling inequalities, and that can contribute to people's mental and physical health conditions. Next slide, please. So this is the work that we're doing, is looking at things like our high streets and seeing how can we change the systems that exist around us so that there are more healthier choices available, because at the moment the system is often weighted towards the unhealthier choices, and we just want to sort of tip that balance a little bit. Next slide, please. So we held an event bringing together people who work within the planning systems and people who work within public health who are interested in looking at the planning system and how it supports placemaking for well-being, because we feel that if we can address the built environment around us, then we can actually work to reduce obesogenic environments. So we brought together people from public health, from health boards, from national and regional and local planning teams, and really brought people together who are involved in planning and design. We held a hybrid workshop, which was a challenge in itself. And what we really wanted to do was to bring these people together who didn't necessarily connect with each other in their routine work, to help everybody come together and understand the planning system as it currently exists, identify its strengths and weaknesses around planning in terms of thinking about placemaking for well-being, and then to begin to together develop a vision of the planning system we would like to have, so that we could create plans and approve planning processes that actively work towards supporting well-being, rather than this sort of ad hoc system at the moment that we have. And we chose to use the 3 horizons method because we recognize that as a tool, it can help people to develop a shared vision of the future, whilst it also acknowledges the complexity and uncertainty of the current situation and working in the future. So it was really important for us that we chose a tool that really actively and explicitly recognizes complexity. Next slide, please. So this is the 3 horizons tool, and you start by looking at horizon 1, which is the red line, and that you get everybody to think about what's the present situation, what's the present system, what are your current concerns, what are the challenges working within the environment that you currently work within, what are those burdens, challenges, hurdles that we want to overcome. And then you do a jump to the green, which is Horizon 3, and that's about the future aspirations. So that's when together you start thinking about, so what can we imagine the system in the future would look like? The example on this slide is 2050. What would the planning system look like in 2050 if we get it to a position we want it to be? What does a planning system look like that supports and promotes health and well-being rather than the current situation we have? And then people start putting down a lot of their sometimes blue sky thinking, but sometimes really positive things about how data systems might actually work together than the current challenges we have around data at times. And then from that, you move to Horizon 2, which is the blue line, where you think about what are some of the things that you would need to get in place in order to get to that green space in 2050. And that's about this. So the Horizon 2, that blue, is about the space for innovation, initiative, actions, those little steps that will take us incrementally closer to the vision that we want to create. So we encouraged people to think about, with the workshop, focusing on the current situation, the present concerns. What are the challenges in our current planning system? What needs to change? Why does it need to change? And what are the things that are useful within the current system? What are those things we want to keep? And then we moved through to follow those discussions of the vision we wanted to create, and then some of the steps we would need to get in place to move on. Can I have the next slide, please? So doing that, we got a lot of flip chart paper, and then I took it away, and with a colleague we went through and we did basically some qualitative thematic analysis. And we focused initially on Horizon 1 because that's the current issues, and some themes came up, and then we looked at Horizon 3 and then Horizon 2, and these were the 8 themes that everything fitted into actually across all 3 horizons. So what I found really interesting, having not really used this approach before, was that the themes came up in Horizon 1 actually were the same sort of themes that were identified in Horizon 3. So there was a really clear follow through for us of the areas of action that are needed, and how working on those will change, hopefully move us from being current issues into actually a supportive system. So next slide, please. So I'm just going to give you a little example of what the analysis looked like. And if you could go to the next slide, please, because my Welsh isn't good enough to read that properly. So this is an example from theme 2, which was about the planning and public health interface. And as you can see, we identified the different things that came up in Horizon 1, the system, the future vision for Horizon 3, and then some of the steps towards that vision. So what was identified in Horizon 1, for example, is that lack of cohesive and consistent approach across Wales, a lack of robust evidence, siloed working arrangements. Steps towards changing things would be consistent training and processes, public health data and evidence being able to inform the planning system, and simplification of routes to public health data, and increased opportunities for joint working, because the vision we have of a system or of planning for placemaking around well-being is a system which promotes clarity around the key players and provides opportunities for joint working, networking, collaboration, and public health and planning work side by side, which isn't the situation really very easily at the moment. Next slide, please. So my reflections on the tool, I hadn't used it before we ran this event, and it ended up being about 28 people face-to-face doing workshops together, and about another 25, 26 online doing workshops online. So I think, I dived in the deep end slightly. It was quite, a hybrid event with a lot of people and using a new tool. But I'm definitely an advocate of the 3 horizons. It really was useful in helping us to start those conversations about developing that shared language, that shared vision, enabling people to think about not just their perspective, but slightly wider, and hearing other people's points of view. And because I'm working on a systems approach around healthy weight, you could also really see that even though we weren't doing system mapping, it really helped people to begin to understand the wider system and their place in the system. Next slide, please. The challenges were that, so I understood the tool, and I did a briefing for facilitators, and I talked people through, well, I talked my colleague through the process, and then they talked other people through the process. And definitely the Chinese whispers didn't help too much there, because some facilitators found it really difficult to visualize it beforehand, I think. The facilitators really need to clearly understand the approach. Otherwise, I think it can be difficult to keep people maybe on track, or explain it so that the participants clearly understand what they're being asked to do. The biggest challenge I found was, having gathered all this information, was knowing what to do with it and how to manage it. So for me, because my background is in research and evaluation, for me, it made sense to use it to do a thematic analysis and pull it together that way, and see whether those themes cut across the different horizons. And then how you present that information, and then how you use that. And it really isn't an end in itself. And I think this is something that's reflected in the resource that Pep and colleagues have pulled together, that, it's one part of the process, but then you need to follow it up with maybe backcasting to get more detail of the steps that you will take to get to that vision point at the end. So in conclusion, next slide, please. I would say that the Three Horizons tool really helps promote that shared vision and language and agenda, and gets people really thinking about the fact that they're working towards that common endpoint, and identifies the common priorities and goals across different agencies, organizations, individuals. All that working together actually builds relationships and trust, and increases motivation and communication. And that really helps reinforce people's progress towards that vision and supports that. And there's a little link to the tool from PEP and the Future Generations team. So I'm going to hand over to Tom now, I think, to give you a tour of the tool that he used.
Fernanda, good afternoon, everybody. Thank you very much for the invitation, Pep and the team at Public Health Wales. So yes, I'm coming at it from it feels a little bit like the other end of the spectrum, really, very much a low-cost, non-strategic, back of a fag packet kind of approach, I suppose. And as I exemplified, this is my resource behind me. It's a big bit of cardboard. I think the cost is probably about 6 sheets of paper. So I'll share my screen and we'll get on with the presentation here. Hopefully you can see that. Let me know if you can't see that.
It's just on your desktop at the moment, Tom.
Oh, there we go. Excuse me. Did this when we tried earlier. Okay. Can you see that now?
It's still just your oh, there we go, something's happening. Yes.
Right, apologies. Okay, yeah, so just firstly, a very brief intro. Kuba Youth, which is how it's pronounced, is a project of PlanEd. PlanEd's a community development organisation based in Pembrokeshire. Some years ago, there was a gap noticed that young people had very little knowledge of local democracy in many communities, in particular town community councils, and vice versa. Town community councils didn't really connect very well, didn't have confidence in connecting with young people. So the project was set up, funded by the lottery. We've had other bits and bobs of funding, including from the Welsh Government Democratic Engagement Fund. So the aim really was to just try and support local councils to better connect and involve young people in their decision making, and to learn from that and share that experience. So this is a great opportunity to do that. So thank you very much. Throughout the project, we've tried to use different and creative ways, inspirational ways to actually engage with young people. bringing them together with town councillors. So this is a shot from a workshop in Nayland. We had some funding at that point from the Police and Crime Commissioner for ACEs mitigation. So the idea here was to bring young people and councillors together, talk about their communities, strengths and weaknesses, positive things on which they can build. And through that, the hope was that councillors would then be able to take some steps to mitigate ACEs. So this resulted in 18 of these 8-foot by 4-foot graffiti boards being created. This was from the Presellis. And you can see here some of the issues. I'll try and translate them for you. So there's waste and recycling, active travel and transport, community transport, local food, affordable housing, and the general kind of looking after the environment of the Presellis. And there were 18 of these boards created. With lots and lots of issues, and there were many commonalities across the board. So lots of these issues you can see would be very relevant to thinking about futures and sustainability. It kind of added to a lot of existing information that's out there for young people. So that would be one quick ask for anyone listening. You know, if you're involved in consultation and involvement, make use of the existing youth voice that's out there already. It's sat there ready and waiting and quite easy to find. So zooming in on this piece of work, we've been working with Pembrokeshire College for quite a while. We've supported their learner executive to develop and to begin to capture youth voice in thinking about communities. So youth voice is very rich in the college. It's quite raw sometimes though. So this is the kind of environmental stance. So young people often need kind of approaches to be adapted to meet their needs. This project came to the attention of the Future Generations Office. We had some young people at a conference last year and they spoke with Derek, and then we carried on working with the Future Generations Office, which was great. And the law itself is actually a really useful tool to work with young people to get them thinking about some of these community issues. The Future Focus exercise came through just by email, and I found the Futures Triangle quite an appealing tool to use. Basically, I had the challenge of trying to find ways to engage with groups of learners within a tutor period, which is about 40 minutes, not knowing the young people at all, what their background knowledge was or anything. So I put together this resource because, as you can see, the previous one is a little bit dry. I couldn't just give that to young people. To make it colourful, and the features of it really were just to break it down. You know, the first thing we found out is young people had effectively zero knowledge of the Future Generations Act or Commissioner or future thinking, and most of them had never really been asked to be involved or share their thoughts on anything much to do with their communities, let alone future thinking. So we tried to scaffold the young people as much as possible. Who's Derek? So let's help Derek. He's a nice chap. And that very often was enough for them. Quite a few of them actually went off and made badges saying help Derek at break time in the college, which was brilliant. A little bit of information here. This is more as a prompt for me as a facilitator, really, just to remind me to briefly touch on this information. And that was enough to get young people thinking. So the approach itself, the triangle, basically we asked the young people to select a topic they were interested in, maybe relevant to their course or something they were interested in at home, and then to go through these different perspectives of which to think about. So the first one, we asked them to think of the future of their theme or their topic, to allow them to come up with a nice positive vision of where they think things should be going, but maybe think about hopes and fears that could happen in the future as well. To think about the present, what's happening now, the forces that are actually shaping it, and structures and systems. So everything that they needed to do really was colour-coded yellow on this resource. And then the weight of the past, what's dragging things back, what's set in stone, and what do we need to kind of unpick perhaps in the future. And then we colour-coded it. So we just gave a colour-coded post-it to each of those 3 directions. So we had yellow for the future, green for the past, and blue for the present. And we just sort of gave the young people about 15 minutes to go and have a little chat in groups about that. And they started coming up with really quite surprisingly in-depth and rich stuff. And we asked them to present it back then to other people. You know, very brief 2-minute presentation, no pressure, bit of humour, making it fun. And they did that in different ways. So you can see with this example, mental health, you know, there's some pretty good, insightful comments on these different issues. And then we sort of stuck them all up on the wall, and then basically put them back into their groups again and challenged them to answer these 3 questions, which were directly then going to feed into the future focus exercise that the commissioner was wanting to get done at that point. And they color-coded their answers to that orange. So you can see here, hopefully you can read some of these questions 1, 2, 3 represented on these post-its. So some of them are brilliant, really insightful. There's a lot of fun there, quite a bit of humour. I think I like best the what to do if people don't follow the Future Generations Act, give them a good hiding. Obviously, I wouldn't advocate that. We then sort of collated all this information and wrote it up. Well, no, first we collated it onto flip charts, and we totaled up all the comments that were made on those orange post-its thematically. So you can see we managed to actually prioritize the themes and issues that were coming through most strongly. So in this case, thinking about funding and the economy, climate change and transport came through. And we did the same exercise for the other 2 questions. So what do public bodies need to do? They need to change, obviously, hopefully, that's what we're here for. And to listen more to people, and to they were quite keen to invest in treating their staff right and training them, which I think is quite a good focus. And then finally, what does Derek and his team need to do? So need to actually do more to ensure that public bodies are doing what they're meant to, or saying that they're doing. Perhaps a little bit more policing and a bit more of a tough side to the Commissioner's work. I do recognise the challenges in that. Get more diversity in decision making, and that obviously chimed quite well with the aims of our project about youth voice. So we had a lot of young people. I think we had about nearly 50 young people took part in the Futures Technique over 3 sessions, so just a morning in the college. They fed back positively in the very brief chats we had at the end. And then we were contacted by PEP and the team to put this together into a case study. So it was a pleasure to do that. I think what I would say about the resource itself is it's fabulous, but it is a little bit dry. So a few pictures there would have helped people who are perhaps more visual thinkers. So if you want to do a reissue sometime, PEP, then I've got those still. So yeah, that was the Futures Triangle technique. I think in summary, I'll just stop sharing a second. The things that attracted me to it particularly were its low cost technique. It's very adaptable, easily understandable, I think, once you sit down and look at it. And I think the learners found that really quite an understandable way to break down this quite complicated problem about the future of whatever subject they'd come up with. And by going through it in little stages, little bites, it managed to kind of scaffold the learners, and they were able to, go from one concept to another without getting too bogged down or too confused. I think in terms of challenges that we found, young people, in my experience, despite the law having been around for nearly 9 years, and despite schools and so on, theoretically having kind of youth voice structures and so on, people aren't used to being asked their opinion on things. They're not used to being involved. They're not used to actually there being any expectation that what they say will have any impact. So there's a really big job there to do throughout society. I would urge more of a lifelong approach to this kind of thinking about sustainability, about involvement and participation, right from birth through primary, secondary school, university, adulthood, right through to older people. What would I do differently next time? I think I would tie it into a digital tool that we've been using quite successfully in the last few months, Mentimeter. I'm sure many of you are familiar with it. And that was quite appealing to young people to use that. And I think it would work quite well with a technique like the Futures Triangle, just to capture the richness of the information that they came up with. So that is me, really. That's the summary of Cuba Youth use of the Futures Triangle. If any of you do have interest in youth voice and participation, we're shortly you are going to be releasing all the findings of the project, Cuba Youth. So if anybody wants to get hold of that information, I'm sure we can work that out through the team.
Brilliant. Thank you very much to you all. So it was really great to hear from Pep about the different techniques. So I repeat that there were 12 different techniques in the toolkit. Some of them are classic, you know, things like horizon scanning, backcasting, or the free horizon model Sophia was talking about, but there are also different techniques people don't know that much about, like the one Tom presented on the futures triangles. I really like the 7 questions as well. And some of them are very easy to dip your toes in it. And in our office, we also chose the free horizon model to start the future thinking exercises. And so thank you again so much for sharing your experience and how it was to actually apply the techniques and the tips, you know, for everybody who comes after us as well. Could I ask Jamie, before we take question from everyone else as well, about the second poll, please, with the second question? Brilliant. That looks fantastic, even better than I ever imagined or dreamt of. So thank you so much. And maybe if you could put in the chat, you know, or come and talk to us in the conversation now, what do you think you will apply these tools for? And I didn't see many questions in the chat, but Tom, somebody said if they could have further information, so your contact details are in the toolkit, or they can, I'm sure, reach you through the chat now. So would anyone like to come and share with us maybe what they are thinking of applying a futures technique for? Needs assessment and strategy development. Yeah. We worked with some councils as well to help them decide on their new corporate strategies and the planning for it. So we used different technique, like the youngest person in the room, that worked and really well. Landscape features. And the landscape features, yes. Service improvement, yeah, totally. Yep, future business service planning. And as we are discussing, you know, futures techniques as well, you know, the whole of the Wellbeing of Future Generations Act can be described as a backcasting exercise. We have agreed with a national conversation, the vision we collectively want for Wales in 2050. And then we are working now and backwards what needs to happen through the goals and using the 5 ways of working. And the national indicators and milestones are just the checks to make sure we are going towards that desired future we would like. So it's another example of doing future thinkings without often realizing that's what we are doing.
I have a question.
Pep has a question.
I have a question to the other presenters. There's because obviously you're featured, both of you, in the resource yourself, with alongside a specific method like 3 horizons and the Futures Triangle. And you'll be glad to know, Tom, Futures Triangle is gaining a bit more more traction, not fraction, in Wales now. Welsh government apparently really like it. But I was going to ask, have you had a look at some of the other tools, and do you think there's anything else in there that you might want to try out yourself? I know, Sophia, we were discussing trying out a bit of landscape futures, I think, in the upcoming mapping exercise, but have you seen anything else that you think would be useful for your work?
So the backcasting and the pre-mortem, I think, are really interesting ideas. So so, and both of them kind of look to a future. So with backcasting, again, you're trying to identify the steps that will get you to where you want to be, and bringing that back step by step until you're at the present. Whereas the I think it's called pre-mortem, I hope I've got that right.
Yeah.
It's about imagining your long-term vision 10, 20 years time and the worst case scenario. And nothing has gone the way you wanted it to, and everything's failed. And then it's about thinking about, well, what would be the reasons for things failing, and what can we start putting in place now so that we preempt that sort of thing. So if that's what I've understood it to be anyway. So Pep, I'm happy to be corrected, but I think those are interesting ideas, and
You are
hoping I
correct.
can at least hoping I can at least test out the backcasting, and maybe also that work that we're hoping to do around some food mapping.
And Sophia, the worst case scenarios and what can go wrong is a technique I use for risk management. So for risk management of projects, or for our whole office, I say, okay, let's do apocalyptic, everything went wrong. And so then we can work out, okay, so what are the different elements we need to manage now to ensure we get again to the opposite of that future we do not want. Yeah.
Exactly.
Brilliant.
And for me, the triangle got used at basically the middle part of the youth project that we had, which was kind of more about the youth voice and trying to dig down into the issues, what the young people were thinking about. And the final part of the project was much more about trying to get councils and councillors to actually listen to some of the things that the young people have been saying, and to focus on what was going to work best in terms of their community, and finding some mechanisms for involving young people. So we kind of stopped asking young people what they thought about their communities and so on, thinking more about how can we actually get some sustainable kind of engagement going between those ones. But it's certainly there in my box of tools now, and I do look forward to using that in future projects.
Yeah, and there's a lot. Yeah, I think some of the creative methods as well, particularly around involvement, tend to work quite well. Postcards from the future and whatnot we have used in the past, but I can confirm the risk exercises I find very fun, the apocalyptic ones. Not a lot of people in the office do, but I find them very, very entertaining, because then you get to talk about, oh, how do we deal with that ahead of time? And it has worked really well for some of our projects as well in the past.
So when you say colleagues don't like it depresses them.
Yeah.
So there's an element of it's quite scary to really grapple with real risk perception, and so you go in a very negative space. So it's really important to work as well on a way as team building, or to get out and not stay in the negative mindset, and especially with futures. We know that the general perception of the future is quite negative. If you look at surveys of people and what they imagine the future to be like. But in order for the human brain to be able to become creative, solution focused, you need some optimism and positive. And that's what we are trying to do as an office as well, is to bring back the positivity so that people can access again this part of thinking, and we don't freeze because the future looks too horrible. So that's why some of the techniques as well are very helpful, to look at the opportunities and the positivity in everything. And I saw in the chat a comment from Stephen, about England, but we are so lucky in Wales, because we have the Wellbeing of Future Generations Act, and this toolkit was created with Public Health Wales. So that really tells you as well, the value we put here in Wales of all these things, and that's why I'm so fortunate, and I have stayed in Wales, because we have so many great opportunities, different ways of thinking, and even legislation to force us to do it, because we really need to do it as a nation, but also globally. Would anyone else share anything or come online? No?
I'd quite like to add
Yeah.
something as well, I suppose. Just thinking about the inequalities, I think one of the advantages of a lot of these tools, and whilst they might look quite dry in the toolkit, I think the advantage is that they don't feel very corporate at all, and they're sort of challenging to organizations, and they're new approaches. They're not very, I don't know, officey, I suppose I want to say. So I think from that point of view, they can be really useful again, because if you're wanting to tackle inequalities, actually we need as many people in the room as possible, and these techniques are open to that.
Yeah, thank you. Yeah, we found that as well in our exercise, that it's a great support to facilitate involvement and also team building and team bonding, you know, because you can explore together, you know, the future we want, what should our organization be about, what is it we don't want, how do we get there, etc. And it's very human. So it really helps create relationships and rapport as well as we explore these less well-known territories. Brilliant. So that's all what we have time for today. And many thanks again to Pep and Louisa, especially for designing the toolkit and trying to make it so accessible to everyone and inspirational as well. And then thank you so much to Sophia and Tom, you know, for sharing your experience of doing it and sharing your tips and your contacts. And just before you leave, we would be so grateful if everybody could complete a short evaluation. You know how important they are, you know, for as the organization putting the webinars. So a link will be included in the chat, but also sent to you. And we really hope you will come and join other events from the Public Health Network Comrie. And if you're not a member, I encourage you to join them. So thank you very much again. Diolch en fawr, and see you all very soon, I hope. Thanks. Bye.